If you're thinking about getting veneers and are going to be spending thousands of dollars in the process, then I think this video is going to be worth your time. Hi, I'm Dr. Joseph Houlik. I'm a member of the American Academy of Cosmetic Dentistry, and we do a lot of smile makeovers at our practice, and here's everything that you need to know. We're going to be going over what they are, how they work, the cost, different alternatives, the process, and some other things you should be thinking about that no one else may tell you. So what are veneers? They are thin ceramic, which is porcelain, or composite restorations bonded to the front or the edges of the teeth to change the shape, color, length, or the alignment of the teeth. Think of them like a contact lens for your tooth. So we're going to take this little shell, we're going to put it on the tooth that is going to help us achieve the results that we want. And most veneers are very thin. We're talking like 0.5 millimeters. What about veneers versus crowns or caps? So veneers typically cover the front or the edge of the teeth and require less kind of enamel reshaping. Crowns, on the other hand, are going to cover the entire tooth and go all the way around. So they typically require a little bit more reduction. A good rule of thumb is we want to work on the teeth the least amount that we can and still get great results. So if we can achieve that by just covering part of the tooth, then veneers will work great. If the tooth has large cavities, cracks, fractures, break, heavy wear, fillings, you name it, then a crown may be safer and stronger. So veneers may be a good fit if you don't have a ton of decay, really large old restorations, different fractures, breaks in the teeth, or maybe you have some little spaces, some minor rotations, some crowding, just some unevenness or discolorations that you'd like to correct. So when it comes to veneers, there's two types. First, the porcelain or the ceramic ones. These are going to be the more expensive, kind of better option that are going to look the best, hold up the best over time, stain the least, and be the most durable. There also are composite veneers, which is basically like a filling material that we lay on the front of the tooth. Now, these are a more cost-effective alternative for patients. They may not last quite as long. They might build up a little bit more staining along the edges. They still will look great, maybe not quite as good as the ceramic veneers, but again, can be a great cost-effective alternative for patients. So how do we choose if we're going to do the ceramic and porcelain veneers versus the composite veneers? Well, most of the veneers that you see or that are going to be done are the ceramic and the porcelain veneers, that's pretty much all that we do at our office. Now, that is just because they hold up the best, they look the best, and this is typically what patients want. Now, composite veneers can be a great option if you absolutely have to do it kind of in the most budget-friendly way. That's when I see the composite veneers typically being done. How long do veneers last? Are they permanent? What's the longevity look like? No dental work is truly permanent. Porcelain veneers, on average, there are some studies showing that they can last between 10 to 15, usually around 15 years when done well and protected. Some could even go up to, I think one study said maybe around 80% last even up to 20 years. Now, composite veneers typically don't last quite as long. They could, but in general, you're going to be looking around maybe 7 to 8 years, maybe 7 to 10 years with some touch-ups, some polishing, buffing out some staining here and there. After about 10 years, what would the veneers look like in both cases? Well, typically for the porcelain, they're going to look the exact same because they really shouldn't stain or discolor. The one thing that I do see with those is that over time, if the gum recedes a little bit, then patients can sometimes see where the veneer meets the tooth that they weren't able to see previously, or that little area can collect staining. Same thing with the composite. This can happen with the composite veneers as well, in addition to them losing a little bit of their kind of gloss or sheen and picking up more stain than the ceramic or porcelain veneers do. Now, what about replacing veneers? Do you have to replace them every so often? The short answer to this is no. Really what you need to do is think about if they're decayed, if they're broken, if they're not up to par, then of course that's a good idea to replace them. If you're not having any problems with them, but maybe there's just some edges that are staining or something, then you don't have to replace them, and veneers do not have an expiration date. If the veneers are continuing to come off repeatedly, this is one of the most common ones I see, that they've had it done 15 years ago. The tooth is maybe ground on a little bit more than it should, and maybe that bond isn't as strong, where trying to do a veneer and then redo a veneer just isn't going to hold up very well. And sometimes we have to end up going in and crown the tooth to basically have more tooth to hold on to. So what really drives the long-term success of the veneers? Well, in my opinion, there's really the three things. Number one, how well they're done. Number two, how well they're taken care of by the patient. We can do the best we can. We need patients to help us with that. And then number three, how well they're protected. So pretty much every patient who we do veneers on gets a night guard or some sort of orthotic to help protect the ceramic restorations, to basically help them hold up as long as they can for patients. What about cost? So how much do veneers cost? Well, for porcelain veneers, they typically going to start around $1,500 per tooth. This can go on up to maybe $2,000, maybe even above that, depending on where you live, of course. Composite veneers are going to be less, typically maybe around $800 per tooth. So then it really just becomes a matter of how many teeth are you going to be doing, and then multiply that by the amount per tooth. So there's some patients in our practice where we've gone in and we've literally veneered one tooth that was kind of misshapen, or we've done two, or we've gone in and have done the whole mouth. So it just depends on what's important to the patient and how many we end up doing. Now, some other things to keep in mind as far as the overall cost of things. Yes, you've got the cost per tooth, then how many teeth are we going to be doing? The dentists will probably charge you to some form of like smile design or wax up fee, which I would expect to be between $300 and maybe $1,500. And then of course there's the night guard at the end of treatment. All in, you've got the amount per tooth times the number of teeth, and then some of those additional things to get the great result and then help protect the veneers. Now, are veneers covered by insurance? Typically not. Veneers are considered a cosmetic, more of an elective procedure by dental plans, and so they typically are not going to cover veneers. Now, crowns are a little bit different. So remember previously how we talked about crowns are better for teeth that are broken, have large decay, large old fillings. But here's one thing to keep in mind. Crowns are different. Let's say that you end up needing a couple crowns up front and not really true veneers. Your insurance may actually help with this. Most plans, I'm going on averages here, will cover maybe around 50% of crowns. So if it is in fact a crown that's needed and not a veneer, then your insurance may actually help and reduce your out-of-pocket amount. On average, this might be between $400 to $600 per tooth, your out-of-pocket amount, until you hit your maximum. The big takeaway here is veneers may not actually even be the best thing for you. You know, if you've got decay, fractures, large fillings, different things, then crowns actually may be more appropriate, and insurance may help with this. That's why don't write off the veneers. It could be worth a consultation with your dentist. What about FSA, HSA, and other payment plans? So for FSA and HSA, this is going to work very similar to insurance. So they're going to want to basically prove or have some sort of document stating that these were necessary to do. And so if it's a purely cosmetic case, then veneers typically don't qualify for using these funds towards them. But if it ends up being that you need crowns because of significant decay or different things, then they might end up helping for it, and you may get a new smile through it. So what are some indications for veneers, and what can they best help with? Well, the most common one we see in our office is basically kind of wearing or thin enamel, particularly on the front teeth, and more so along the edges, where patients start to get more craze lines in the teeth. They've got uneven wear, chips, little breaks here and there. They don't like the symmetry of the teeth. The teeth are chipped, maybe notched, have flattened down or been worn down a little bit. Another one that we see very commonly is just for some color correction or smile enhancement, where we want to kind of make things just match a little bit better, where we go in and maybe fix 1 to 2 teeth and match it with the rest of the teeth that they're happy with versus redoing the whole smile. Another one would be like just complete smile makeover. So if a patient wants to change the color of the teeth, the length, the shape, everything, you name it, then we will go in and basically redo kind of the whole smile. Some other indications to do them are for mild misalignments. When I say mild, you can kind of camouflage some minor rotations, some crowding, maybe some spaces here and there. But the general rule of thumb is the straighter the teeth are at the beginning, the easier and the more conservative doing veneers will be. The more instant orthodontics, the more you try and correct the alignment of the teeth with the veneers, the harder it's going to be, and the more kind of reshaping or grinding that you're going to have to be doing on the teeth. And it's not uncommon, and we do this quite frequently in our practice, for patients to do a quick kind of little series of aligners or Invisalign before we do the veneers, just to fine tune those things, so that then we don't have to kind of reshape the teeth as much as you would have to if they were still kind of crooked or crowded, so that we can plan for the most conservative veneers, which often leads to a better final shape and overall result. So what's the process like in the overall experience? Well, number one, the first thing is the consultation. So to determine the smile objectives and just the patient's overall kind of oral health status. Once we have our objectives put together as far as how many teeth we're going to be doing, the type of veneers we're going to be doing, then the second step is for the dentist to come up with the smile design and order the wax up or the mock-up of what the new teeth will look like. Third is the preparation appointment. So once the mock-up's done, the patient comes back in. This is the really exciting day where we work on the teeth, we kind of reshape them, recontour them, and then you leave that day with the provisionals or the temporaries on the teeth to begin to take the new teeth for a test drive to see how you like them. Do you like the length, the color? Is there anything that you want to change? Number four is to come back to the office to deliver the final restoration. So we'll bond or cement the veneers that day. We will remove the old ones, try on the new, make sure we like them, make sure the patient and the doctor are happy with them, and then of course cement them or bond them that day. Number five is to make a night guard or something to protect them, and then ongoing care and follow up. What about the time frame? How long does the process take? From the initial consultation, it takes about 3 weeks to get the smile design and the mock-up back in our office. And then after the preparation appointment, it takes about 6 to 8 weeks to get the final veneers back. Now, of course, this depends on how many units we're doing. If we're doing 2 teeth, it'll be much quicker. But if you're doing multiple teeth, it could take between 6 to 8 weeks to get those back and get those bonded on. So in general, I tell patients to budget between our first consultation to when the definitive or the final restorations will be on there. I tell them to budget about 2 to 3 months. And most of this time will be spent with your temporaries on, which should look great and hold up very well for you. Now, as far as the actual appointment itself, it depends on how many units we're doing. But if we are doing a whole smile on a top arch, I tell patients to budget or allow between 5 hours or so. Basically, I tell them to block off their whole day, but we're usually done by 1 or 2 o'clock. If we're doing a whole mouth, like the top and the bottom teeth, then that might take maybe closer to 7, maybe even 8 hours, which is a long time in in the dental chair. This includes, of course, reshaping the teeth, getting any scans, impressions that we need, making the temporaries look beautiful so the patient has a good idea of what they're going to be getting our photos, you name it. And when it comes to the day that we deliver the the definitive restorations, I tell patients to allow about half of that. So if that may be a couple hours, if we're doing a whole mouth, maybe about 6 hours. Common FAQs with regards to veneers. Are veneers painful? Well, they really shouldn't be. The preparation appointment can be long and it can be uncomfortable, but the teeth really should have pretty minimal sensitivity afterwards, especially if we are able to do the veneers with minimal grinding. So the feedback we've gotten from patients at our office is minimal as far as discomfort or sensitivity they've had. If anything, I think the most discomfort is just gum irritation from the procedure. Can teeth go bad under veneers? Yes. Veneers are not bulletproof. They can decay and have problems. So like we talked about, doing them well is up to us, and then taking care of them is up to the patient. And so remember that they are bonded to your teeth, and your teeth can still decay. And veneers, once they're on there, are very strong, should last a very long time, but the teeth can decay around the edges. And so you have to just make sure that you're doing a great job taking care of them. What are some disadvantages or other cautions you should be thinking about? Number one, when veneers really aren't right for you. If your goal could be met with a much simpler option, such as maybe aligners, some whitening, maybe a little edge repair, filling, stain removal, then that would be a good place to start. You don't necessarily have to reshape healthy teeth just for looks without talking to your provider about different plans or options in order to achieve what's the most important to you. A lot of patients ask, can I go back to normal teeth after veneers? Typically not. The majority of veneers out there are going to reshape the teeth enough to where if you were to remove the veneers, then the shape of the teeth would look a little off. Something would look a little funky. There might be some cases out there, true no prep veneers, where you could remove the veneers and life would go on. But the majority of them, once you are committed to working on the teeth of veneers, then you pretty much are committed to that process or some type of restoration on that tooth for the long haul. Which brings to my last point, is the key expectation of most veneer preps and appointments are not going to be no prep veneers. You can definitely have providers or get them done with minimal reshaping or prepping, but most cases will require some kind of conservative enamel reshaping in order to get the best results that we can for the patients. Some other cautions or things to be thinking about. Number one, work with an experienced provider who will provide you with a clear, concrete plan that is in place before you actually begin even anything. I'm talking about the smile design, the mock-up, what's the bite going to look like? That way you know what the final teeth should, or very close kind of rendering of what the teeth are going to look like before you even start the process. This should allow for the dentist to keep the preparations as conservative as possible to maintain as much natural tooth structure as possible, which is ideal and should lead to the best long-term results. The last thing with regard to caution is plan for protecting the teeth. Now, I have some patients who swear, I don't grind, I don't need this, the veneers are strong, they're going to be fine. No, you either, whether it's retainers or night guard, discuss it with your dentist as far as which one's best for you to protect. I mean, it's an investment, right? You're investing thousands of dollars into your mouth, in your teeth, and don't you want to protect that investment? And I think the answer should be yes. What about some alternatives to veneers that you might consider? A lot of patients who come in for veneer consultations don't necessarily end up getting veneers done because it's not necessarily what they need to get the results that they want. And here's what I mean. Depending on what the goals or where their confidence is going to come from, maybe just some simple whitening procedures in office, at home, can get them the results that they want. Some simple aligners or orthodontics can fix a rotation, crowding, close some spaces without having to reshape the teeth. Maybe a composite filling or bonding here and there. Maybe a couple crowns here and there. Some gum lasering or recontouring. A lot of patients too might need a combination of these things. So it's not uncommon for the patient to maybe do some whitening. Then we've repaired a couple fillings here and there where they've stained, and then we might veneer 1 to 2 teeth or crown 1 to 2 teeth. And so a lot of times it's a combination of things. And the big takeaway here is you may not necessarily need veneers, and veneers may not be the best thing to you. And there are a lot of our alternative solutions that your provider can offer you to get you the results that you want as far as what is the most important to you and what is going to help you with the most confidence in your smile. Here's a couple photos of patients that have trusted us with their smile and that we've done here in our office. I know we discussed a lot. Hopefully you guys got some value out of that video. Veneers are not for everyone, but they can be life-changing when done correctly. We've had patients who have trained themselves not to smile because they were so insecure about their smile, and then we see them a month later and their energy is different. They're more glowing, they're smiling, they're more outgoing. And so I've seen it firsthand that it can definitely change people's confidence. So if you're considering veneers and want to know if they're right for you, drop a question in the comments below and I will get to it as soon as I can for you. Or if you're located in Kansas or in Wichita, Kansas, feel free to visit our office or give us a call if you'd like us to help you with your smile. Thank you guys for your time.